to a lot of national conferences, and it's great to have the quality of speakers that appear nationally come into our Minnesota home offices and to participate. Today, we're lucky to have Andrew Cohill, who's from Virginia, and that's the state of Virginia, not Virginia, Minnesota. And Andrew is really an early thinker, a big thinker on broadband and technology, and combines that theoretical of what's possible with the ability to make it happen financially. And so he's been around since the early days of the internet and is always coming up with great ideas for helping communities and regions, including very rural regions, make things happen, improve broadband networks. And so from the early days of the Blacksburg Electronic Village to today with the Blacksburg, Virginia, building a self-financed, privately financed open access network there. A lot of great things have happened. So Andrew, thank you very much for joining.
Thanks, Bill. I appreciate the opportunity. Thanks to everybody for taking a little time out of your day. I think we're all getting more used to online conferences, and I've been pleasantly surprised that I've been doing a lot of them, as I'm sure all of you have, and I think we're all getting more comfortable with them. It's a little easier to interact and do things. My talk is something I've been thinking about for a while now, beyond speed. And it may seem a little counterintuitive because you might say, well, there's a lot of places, particularly in rural America and rural Minnesota, that don't have the kind of speed they want. So why are we already talking about beyond speed? I've been very bullish on most communities and most homes and businesses getting fiber for a long time. It's taken longer than I thought, but it's accelerated dramatically in the last 12 to 18 months. And certainly COVID has created a kind of a land rush for fiber. And it's surprising. There's many rural areas now that are getting really high quality gigabit fiber before many urban areas. And that's because largely because telephone and electric co-ops have finally begun to address this issue for their customers. And in fact, one of the things I've been talking about is a new digital divide between, and we've traditionally talked about rural versus urban digital divide, where urban communities have some fiber and are getting more, but have had fairly good cable service versus a lot of rural areas that are still on DSL or even satellite and dial-up in some cases. But this new digital divide is rural with fiber and opposed to rural without fiber, and it's an issue that has to be addressed. But I'm still confident that most rural communities, most rural homes and businesses are eventually going to have fiber, just as they all have electric service and they all had once working telephone service, although that's getting more and more iffy. We've done a lot of work in West Virginia in the last couple of years, and their Frontier has done such poor maintenance that the telephone network the old copper telephone network doesn't even work very well. But today, what I wanted to talk about is what are we doing beyond speed? And one of the things that troubles me is there's such a focus on, well, we've got to get gig fiber, and somehow that's going to magically solve all our problems. And it certainly, and I don't want to minimize the absolutely importance of getting good fiber or high performance wireless services into more rural communities. But I've started thinking about, well, what happens after that? We can go to the next slide.
Oops, sorry.
And so I don't think speed is enough. And in particular, the really important thing about modern fiber networks and modern point to multi-point wireless networks is symmetric bandwidth. And this is another area that was never got enough attention until this year, and the COVID crisis sent millions of workers home and tens of millions of school children home, and expected them all to be able to work via two-way video. And it was immediately became apparent that 10.1 DSL was not really capable of supporting a good quality two-way video, and that in fact a lot of cable systems with the somewhat artificial FCC requirement of 25.3 also couldn't do that very well. So symmetric bandwidth is absolutely critical. There's another very interesting conversation about why the FCC has rather stubbornly ignored the need for symmetric bandwidth. But today, what I want to talk about is speed and bandwidth are just a means to an end. And so, if we go to the next slide, I'll tell you more about what I'm thinking about. So we know that the COVID crisis has changed the way we work, and in many ways, it appears to be a permanent change. It's just, I see almost daily, if not several times a week, companies are announcing they're going to allow more and more workers to work from home permanently, even after the COVID crisis subsides. So the networks that we've been using with asymmetric bandwidth and often high latency aren't going to support work from home, and don't support learning from home very well. So we go to the next slide. So fiber and high performance wireless is an enabler. What are we trying to accomplish? And I think we ought to be able to improve our personal quality of life, our professional and business quality of life. We ought to have improved access to educational opportunities. And I think one of the big changes we're going to see in education, particularly in higher ed, is a wider availability of getting certificates and degrees online, as opposed to the relatively high cost of a campus-based higher education degree. And so being able to take classes online is going to continue to be very important. Improved access to healthcare. It's interesting that part of the way we dealt with the COVID crisis in terms of healthcare was a greatly increased use of two-way video. Many health systems now offer online access to your own healthcare information. Doctors are now asking patients to send them their things like their blood pressure and their blood sugar, or other kinds of blood oxygen levels, things that can be monitored at home. And of course, you have to have the network to do that. Safety and security and energy and use and management. We have opportunities to use less energy and use it more efficiently. And the Ring doorbell, in terms of personal security and home security, has been interesting. I talked to an ISP recently who said his biggest problem was the bandwidth consumed by video doorbells. Many of those doorbells are constantly uploading high quality video over the internet to servers, cloud-based storage somewhere. And the ISP said he had to redesign his network to be able to provide better support for those kinds of things. So it's good that we have these kinds of things, but we need to think about how we use them and what are the implications for the network. Next slide. So I think there's four enablers. There's access, which I've been talking about in the first 2 or 3 slides, bandwidth, symmetry, and I think what we don't see enough of is choice of providers and services. With the 84 and 96 deregulation of the telecom industry, there was much hope that we were going to see more competition and wider choice of providers. And instead, what we've seen largely is what I call the balkanization of networks. It's true we have more providers, but most of us only have a choice of perhaps mediocre DSL data service and one other provider, perhaps wireless or cable. So we see a lot of what used to be very large monopolies being chopped up into smaller monopolies and in smaller service areas without the benefit always of improved pricing or a wider choice of services. Utility is what we do with the network. And I've already talked a lot about that. K-12 learning, office work, telehealth, personal cloud data storage, remote access to other kinds of services. Security, I think there's energy security, being able to manage our homes and our businesses in terms of energy use, being able to create programs that turn off things like water heaters and heat pumps and furnaces when we don't need them. Safety, like improved access to things like video doorbells and in-house detection devices, other kinds of home utilities, and then privacy. We're seeing finally some alternatives to some of the more popular social media. As we all know, Facebook and Google, particularly, and to some extent Apple, provide a lot of free services, but at the expense of giving them all our personal data, or most of it. And so we are seeing the rise in social media of some alternative social media platforms like Gab and Parler. Health data should be private. Lots of us enjoy the benefits of personal assistance, but like our phones, they often are listening 24/7 to everything that's going on nearby. So privacy is becoming, I think, a critical issue. Next slide. So access, this is where all our work has been focused really for the last 20 years, and the work's not done. We need more fiber. We need more high performance wireless in rural areas. And in particular, I think we need more choice in terms of providers and services. I'm somewhat of a renegade in terms of believing that, well, everything's going to be over the top. If you have an internet connection, you can get anything you want. There's some drawbacks and some trade-offs we do for that. And I still believe that in the future, we're going to see other kinds of niche services that may still require internet access, but aren't strictly speaking over the top in the same way. Mobility access is important. This is something we're still trying to work out in a lot of communities. Wi-Fi, public Wi-Fi is still not widely available, even though we have devices now that can take advantage of it. And the reality is that we want mobility access everywhere, but part of that also comes with a price in terms of privacy. As we walk around with our phones, both the cellular companies and to some extent the computer companies like Google and Apple and others are collecting our location data, among other things. Next slide. So utility ought to be about making life easier and better. It's been interesting. I've been studying video conferencing cameras, and the webcams are certainly much better than they were a few years ago. What we found in my business is that the webcams don't work very well in small group settings. If you've got 3 or 4 people sitting around a table and they're trying to have a conference with someone else, the webcams don't work very well. We're starting to explore higher end webcams with better lenses and wider fields of view. The other thing we've discovered is in small group settings, the microphones are woefully inadequate. And so you probably all had the experience lately of trying to participate in a video conference where there's a large group of people at the other end, and there's one microphone in the middle of the table, and everybody sounds like they're talking from the bottom of a well. So we need more work on technology. We need to learn more about how to make remote learning better. I was reading a paper by a professor that's had to, like many professors in higher ed, has had to switch to a largely online format. And he said he found that he gets a much better response from his online classes by using 3 cameras. He's got one camera focused down on the desk looking at printed materials. And he's got a camera that provides 2 different views of him to create a little more liveliness in the presentation. And he's got a little switch box that enables him to switch those back and forth. The personal assistants, I think this is a largely untapped and really interesting area. As we all do eventually get older, we want to live independently as long as we can, and personal assistants like Alexa, Siri, and other kinds of personal devices that you can talk to and use voice recognition. But we haven't seen a lot of add-ons for that. They do mostly what the companies like Apple or Amazon or Google want you to do with them. So a lot of it's entertainment based. If you like music, they provide a wonderful way to conveniently listen to all kinds of music. But we ought to be thinking more about improved safety in the household. How do we interface those with medical devices to support both safety for the very young and the elderly? My grandson is a climber, and my daughter is constantly struggling to keep him from hurting himself by falling downstairs or climbing on bookshelves. And I think we can make these smarter and begin looking at ways to really integrate those into the fabric of our household. Telepresence, I think I've talked more about this above, but again, richer personal interactions. We're all just kind of staring at our webcams as we are in this, but I believe, again, with better cameras, more thoughtfulness about how we use these, we can do more with them. I still remember, in terms of improved healthcare, almost 10 years ago, we were building a network in rural New Hampshire. And one of the biggest advocates of the fiber network that we were building was the Visiting Nurse Association. and they were tremendously excited about the ability of some of their patients having fiber and being able to do two-way video rather than having to make house calls. And they said, really, we spend anywhere between 4 and 6 hours a day just driving in the car rather than actually delivering any health care. And they said a lot of it's very routine, taking blood pressure, checking oxygen levels. We now have affordable sensors for most of those things, but a lot of them don't interface. I'm very healthy, but I've taken a personal interest in this. I talk to doctors and healthcare professionals. There's still a lack of common interfaces and ways to collect more of this health data automatically and pass it on to your doctor or your healthcare professional easily. So there's a lot of things we could do there. Next slide. Security. The Internet of Things is completely out of control. You can get all sorts of devices that have an internet interface now, everything from the Ring doorbell to fire alarms to energy management, thermostats, and most of them are very susceptible to hacking. They have not been secured properly, and it's a combination of you're paying $10, $15, $40, or $100 for some internet-enabled device with a very limited interface, and these companies are not building in the kinds of security that you need. I see examples almost weekly of devices that have been identified where they don't have proper firewalls, they don't have proper security, and people can hack into this stuff. But beyond that, there's still lots of other opportunities. The smart thermostats don't interface with a lot of heating and air conditioning systems. You have to have a particular kind of system to use them. So a lot of people who could save money and reduce their carbon footprint, as an example, can't take advantage of them. Again, health security, there's very little work been done on adding wireless sensors to detect health problems, or the infamous "help me, I've fallen and I can't get up" kinds of problems, where you don't necessarily have to wear something around your neck anymore, but you can actually talk to your home. Next slide. And then the last is privacy. I felt very strongly for a long time that we've given too much away. We are too often the product for the services we enjoy, like Facebook. I have a company policy that we do not use any Google Docs here for company work, because when you place something in Google Doc storage, Google has the right to use any and all of that data, even if it's marked proprietary or confidential. So these are popular. Some of them are actually very well designed, but they're listening to us or reading our mail all of the time. I saw somebody was making a joke last week. They said, well, I was going to buy something online, but I wasn't sure that I wanted to get an ad for that popping up in my web browser for the rest of my life. And I've had that experience myself many, many times. You almost casually are browsing for some product or service that you're going to buy, and within minutes, ads for that start popping up in your web browser. And we are slowly getting some web browsers that allow you to uh, control some of that, but we need better controls for our personal data. We need encryption to keep our conversations and data private. I'm alarmed that the government thinks that it's okay for them to read anything they like on our phones and on our computers. And part of the solution is to use more blockchain and Bitcoin technology, but those are very immature and require still, I think, a lot of technical expertise to use those efficiently. And I saw a story recently where someone lost several $1 million in Bitcoin because they misplaced their security keychain, and you can't get it back. There's no way. I forgot my security keychain with Bitcoin. So there's a lot to do in privacy as well. Next slide. So I think digital autonomy is the goal. These are, I see these 4 features or to be interconnected. Each one affects the other in some way, and they're all tied together. And so I think it's something we need to talk more about. There's lots of people looking at various aspects of this, but as a community, I think we've almost come full circle back to the early 90s, where we had community networks talking about all this stuff. And 25 years ago, the network, the software, and the computer hardware didn't have the horsepower to do a lot of the things we can today. But we still don't have, in our communities, in our nation, and I'm painting with the broad brush, but we don't have enough voices to talk about, are we using these in the right way? And are we really doing these things to improve society? You look at what's happening at the FCC level and other federal and state agencies. It's very clear that the large telephone and cable companies and cellular companies still have too much influence, and that legislators are still making too many decisions based on the preferences of a few large companies rather than looking at what the needs are of broader society. And I think, is this my last slide, Bill? This is my last slide. I think one of the things, I was an early advocate for open source. It's really been a disappointment in a number of ways. The problem with open source over the last 20 years is some really great ideas that address a lot of these issues, but most of the open source projects rely too much on volunteers, and we end up with products that have missing parts or pieces, are buggy, or have too many things that they don't do well, just because the interface, they don't have the resources to do really refined interfaces. One of the things I'm actually begun to look at open source personal assistants. There is a group that has begun to develop an Alexa or Siri-like personal assistant. I've purchased several of those. We're beginning to play with those. One of the things we're looking at as a network provider is actually beginning to distribute these to our customers when they sign up, so that we can give them an alternative to the commercial products. So there's a lot that can be done, and I'm hopeful that as more of us get better connected, that we can spend more time looking at some of these things and make some improvements. I'm going to stop there. I want to leave some time for discussion and questions.
Andrew, this is Bill. So could you talk a little bit about open access, the concept of those, and how they support entrepreneurship in as for ISPs, but then throughout the community?
Sure. So what Wide Open Networks is doing is we're a builder and a designer of open access networks. And I had so much difficulty explaining what we do that I coined a new term called LTP, local transport provider. And what we do is we design and build the network infrastructure and then allow any technically qualified service provider to deliver their services over our network. And we have our business model is actually unbundled network access from the services, which I think is the right way to do it. I often use the road analogy. We build digital roads. We don't own all the businesses that use those roads to deliver goods and services. So our customers actually pay us a monthly fee of about $30 to $40 for access to the physical network. They get a full gig of raw bandwidth, and then they pick an internet service provider that's on network. And so they can choose the package and the pricing they want. Utopia, which has often been used as an example of a failed network, has been doing this for over a decade. And they have about 20 providers on their network in the Salt Lake City area. And so some of the providers specialize in business services, others do only residential, but you can pick and choose and shop among a wide variety of providers. And that competition does two things. It lowers prices, but it also improves quality of service, because if everybody's delivering their service over the same network, customer service becomes an important discriminator in terms of picking between one provider or another.
Good, thanks. If you have any questions for Andrew, one of the things he's got going now is a privately financed open access network in Blacksburg. Andrew, do you want to talk a little bit about how that works?
Sure. We started about 3 years ago building fiber in a couple of neighborhoods here in Blacksburg. We raised a small amount of money locally, and late last year we found a private investor who liked our business model so much he agreed to help us expand. And so we're going to be building about 40 miles of fiber in Blacksburg and passing 5,000 to 10,000 homes in the next year. And we're also actively looking for other communities that would like the same kind of network. North Carolina has popped up in the news again recently, but one of the reasons I started Wide Open Networks was the legislative situation in North Carolina, where the telephone and cable companies got the legislators to pass laws that were so restrictive that it was virtually impossible for communities and local government to make any kind of broadband investment themselves. So we were interested in trying to come up with a private sector solution, especially in those areas where the local government or a regional consortium simply can't do that. So we see what we're doing as one of a kind of a basket of options and alternatives. We also help communities design and build their own networks, and some of those have been around for a long time as well.
Okay, thanks. What role does it, a lot of the things in your presentation were kind of warning signs, flashing red lights about internet use. What role, how can a community kind of work to educate their community members about some of these issues? Are there any best practices there you've seen that, providers or public advocacy groups have worked hard on that at a local level?
Bill, I think you just got to the core of the issue in ways, and that's, as I said earlier, I feel like we've come full circle. The early community network efforts in the early and mid 90s were talking about a lot of this stuff. Like, how does the community use this? What does the network mean for the community? How do we support seniors, and how do we improve healthcare? As the internet became commercialized, and virtually all of the early community-based networks ran into financial problems or growth stress problems, those conversations died away, and it became the commercial internet became more about how can we monetize our customers. And so, yes, I'm already greatly concerned. I was concerned when my kids were growing up, even in the early days of things like isolation. We see that now. We have younger people that clearly spend too much time interacting with their phones and devices rather than face-to-face, even video conferencing in many ways. And so there's a whole issue of a whole raft of problems that I do feel like need more attention. And there's some individual efforts. The Electronic Freedom Foundation does great work at the national level on these privacy issues. But the medical community, as I see it, does very little. Strangely enough, that Apple has probably done more in terms of pushing the envelope for using our devices to help monitor our health and take care of our health than I would say some of the large hospital and medical conglomerates. And they've done a better job, I'm not saying great, but certainly a better job in terms of trying to respect privacy. But there's a lot of work to be done.
Good. Any questions out there? Andrew, your presentation today was kind of on these, the four factors there around emerging issues. What do you see as still the biggest concerns around infrastructure deployment, and especially in rural places?
I think, well, as I said earlier, I worry a lot about we're creating new mini monopolies. I'm hopeful that the co-ops are going to keep prices reasonable as they grow and expand their service areas. And I think some of the co-ops might come around to the idea that they can open these fiber and wireless networks up and step back and be the transport provider rather than the service provider. I think the bigger issue in rural communities is it's always about money, isn't it? And I get often told when I go out and talk to a rural community about broadband issues, they'll say, well, we have no money for broadband. And I like to do this little, I call it the 30-year exercise. And I say, well, let's take all the money that your community, public and private business users, are putting in envelopes every month and multiply that by 20 times 12, 240 months. And it turns out, even in smaller communities, it's often hundreds of millions of dollars. And so we have plenty of money for broadband, but we're spending it on the wrong things and in the wrong way. And in fact, we run the numbers all the time. If you can redirect just 5 or 6% of of what a community spends in aggregate on broadband over a 20 or 25-year period, you can build the world's best network to every home and business in that community, even in rural areas. So it's not a technology problem per se. It's the telephone and cable companies have done a marvelous job of convincing a lot of us that this is a very complicated, complex subject that requires a huge multinational company to solve. And as I started earlier, some very small telephone and electric co-ops are actually building better networks than the multinational incumbents. So I remain very bullish about small communities. One of the really interesting things about the COVID crisis is that people have realized I don't necessarily have to live in a big city anymore for my work. My company's allowing me to work from home so I can move to a smaller community with better quality of life, better schools, more opportunities for my children, a safer environment. But I've got to have good broadband.
Do you think the AT&T announcement that they're not going to sell DSL to any more new customers, are we going to see that from Verizon and AT&T as well? And then where will that leave rural places?
Well, Verizon's been doing that for years. I mean, people used to be shocked, but Verizon told Blacksburg, of all places, 20 years ago, we'll never build fiber in your town. And they basically gave up here. I mean, Verizon and AT&T have both like the cellular voice data model, where you have data caps, you have overage charges, you can keep hiking prices up. They have, so we balkanized cellular as well at some level. There's or if it's not balkanized, we have a cartel-like pricing. Yes, I can get both AT&T and Verizon Wireless here, but they're going to be within $5 of each other. So do I really have any choice? And the answer is no. I think there's still an opportunity for smaller communities in a way. Once you get kicked to the curb, you're going to have to face the hard fact of we're going to have to strap on our boots, hitch up our pants, and do something ourselves. And there's a lot of local elected and appointed officials who've been kicking the broadband can down the road for a very long time. And there's still time to fix this problem. Modern broadband networks are easy to build and perform very well, and it's easy to figure out the financing part.
Good, thanks for that. There's a question now about how successful has telemedicine been? Is there a difference in the video technology used to interface the patient and the provider? Is beyond Zoom kind of thing?
I hesitate to answer that. I mean, I'm more of an observer, an interested amateur than a professional there, but I don't see a whole lot has changed other than the fact that, even 6 or 7 years ago, the healthcare professionals were still very reluctant to do two-way video conferences. Well, I have to examine the patient. I can't give you a diagnosis if you're not in my office. And that clearly has been a change for the better. I don't need to physically go to the doctor if I have a sinus infection. I can describe my symptoms, and if I have a prior relationship with them, he can write me a prescription and send it right to the drugstore without me having to go to the clinic and sit in a room full of other sick people for an hour just to get some amoxicillin. And I saw David Asp had his hand up for a question.
Oh, good. David?
Dr. Cohill, what would you suggest we've got fiber to the curb of a lot of these healthcare hospitals and clinics? And how do I get a relationship with the right people at these agencies without just walking in the front door and trying to ask somebody at the reception desk that how do we do from a higher level that get the same product, get the same, do the fiber to the curb, try to make it so that we can work with multiple providers and provide connections between a hospital and a clinic and numerous towns and cities as you have evaluated our network. So I know you know what we have, but how do we get into the healthcare without becoming an ISP?
Boy, David, we could have a long conversation about problems in the healthcare industry. I
But
think
you understand my question is how do we, Dakota counties work with electric companies, Dakota counties worked with all of the schools and all these other areas. How do we get into working with these healthcare hospitals?
I've probably had 40 or 50 conversations over the years with hospitals and hospital chains, and they're very difficult to work with. You can have a really good conversation with the local healthcare provider, even the CEO or the IT, the CIO of the local hospital. But at the end of the day, what they tell you is, well, we're here in Bozeman, Montana, but all our IT decisions are made in Denver. And our hands are tied, we can't make any changes. And so the most promising thing I've seen in healthcare, and this is just my opinion, is what's called the boutique, or there's another term for it, I can't think of it, but you basically pay an annual fee to a doctor who gives you really unlimited access to him or her for the entire year, and it's not insurance supported, which is a challenge for some people, but it's an entirely different model that eliminates the insurance company and major hospital chains as middlemen between you and your doctor. And I think that's a large part of the problem is really the health insurance companies really control almost everything that goes on in healthcare. When I was a kid, and I'm showing my age, I still recall the doctor coming to the house.
On a horse.
No, maybe for you, maybe for you, Bill, but not. No, he had a Model T.
I'm sorry, that was you teed that one up. Hey, I got a question. There's a question about 5G.
Yeah,
Fiber fed towers, 5G, especially in rural. And we know that 5G is a funny word that applies to a lot of different technologies, from illustrated by T-Mobile versus Verizon when they talk about 5G. Do you want to talk more about that?
Well, it's gotten very confusing because different cellular companies are rolling out what they're calling 5G, but they're using different frequencies. Some of the 5G is gussied up 4G. So it's hard to sort it out, but the short answer is it's very limited in distance. You're looking at having to be 500 to 1,000 feet in most cases from a 5G pole rather than a tower. And so we like to do, we did this in Meeker County and Isanti County when we were doing studies there. It's like, well, if you wanted to get 5G to most of the county, you'd be looking at in some cases, tens of thousands of 5G poles, even if you're generous and spaced them 1,000 or 1,200 feet apart. And my bigger issue with 5G, and well, we won't need fiber, is that to get all the benefits of 5G, all those poles have to be lit with fiber. So if you're going to run fiber up and down rural roads to light up 5G poles, well, you might as well just do some really cheap fiber drops at 16 cents a foot and run them 1,000 feet up the driveway to the farmhouse, and get some really good service at a lot less cost. The the cellular providers have made the decision that all our phones are going to work on 5G eventually. So I'm not trying to hold back progress there, but I don't think it's an ideal solution for the home or most businesses.
Good, thanks. We're about out of time. Mary says that what that personal medical service is concierge.
Concierge, that's right. Thank you.
Which, just like the hotels I stay in, most of them don't have concierges,
Right.
So, and I think that'll be the same thing with medical care. Is that again, as you said, the affordability question is important there. The access to that personal service. So it's going to be really interesting. John's question about telemedicine, I put in the chat that, reimbursement was the #1 hindrance to that, is that they didn't want to give a doctor full pay for telemedicine. So the doctor said, hey, well, then you better come in, because they want their full pay for their 20 minutes or whatever time that is. And then the privacy issue too is, the HIPAA concerns, which seem to have gone out of the, out of concern now with the pandemic. But it's a really important question, if you do a Zoom call with your doctor, where is that image, that data being stored? Where is that, are they recording that conversation? Are they collecting the words? Are they, whose network does that go through? And that could be the Zoom server, it could be your Comcast server, it could be a hospital server. I mean, that conversation could be recorded in multiple places without really your knowledge or control. So that's a big challenge for some of these things as we go forward. I want to thank everyone for joining in today. We had talked about these being 45 minutes for a little bit over time, but Andrew, I think that was really interesting, real thought-provoking for as we get this series underway over the next 2 weeks. Tomorrow we have Doug Dawson from CCG Consulting. And I think between Andrew and Doug, two of the best strong thinkers and innovators in the broadband consulting world. So I want to thank you for joining us today.
Thanks, Bill, and thanks everyone for your time today. Happy to take questions. Bill put up my contact information. Drop me a note if you have questions or want to follow up. Happy.
Yeah, and that's Design 9. If you just Google Design 9, you'll find Andrew, and he's definitely. I was only joking a little bit about the horse, because Andrew's was in this business long before me, and I've been in it for a fair number of years myself. So really appreciate your taking the time today.
Okay, thanks everybody.
Thanks everyone. See you tomorrow.